And this is, I think, some of the most important information we can dispense to women and men for that matter. Remember, we have a 50% male audience, and they're going to be glad to hear some of this stuff. Thank you so much for joining us today on Second Act TV. I'm so happy to welcome back Dr. James Simon, board-certified OB-GYN, clinical professor at George Washington University, and the founder of IntimMedicine Specialists. Dr. Simon, thanks so much for joining us again.
Silke, it's very good to be here. I'm really excited about our meeting today. Let's get into it.
Well, today the conversation is about the importance of testosterone for women and why it matters so much for sexual health. Now, I want to start by recognizing that there's a controversy about this, has been for a long time in the medical field, and that we're very lucky to speak with you today to get this straight. I mean, you were at the forefront of women's sexual health. You were past president of the North American Menopause Society and the International Society for Women's Sexual Health. So you have your finger on the pulse here. And this is, I think, some of the most important information we can dispense to women and men for that matter. Remember, we have a 50% male audience, and they're going to be glad to hear some of this stuff. So my first question would be, why the whole testosterone issue? Why is that still controversial or so controversial?
There's a misconception that testosterone is a man's hormone, which, by the way, it is, but it's also a very important women's hormone all of their reproductive lives, and it is present in normal women at about 10 times as much as there is estrogen. So the fact that we have focused almost exclusively on estrogen as the woman's hormone is just wrong. And all of your viewers are keen and understand this, that women's sexual health is almost always, present company accepted, taken a back seat to men's sexual health. And with the absence of good blood tests historically, in the absence of interest in women's sexual health, and including today, in the absence of testosterone products that are FDA approved for women, we have a perfect storm of why testosterone has not been an active conversation for women, particularly their sexual activity and health.
So let's talk about why this is so important, what the actual signs are of low testosterone in women.
Perhaps as a correlate of why we haven't investigated it so well, is that the signs of low testosterone are more subtle in women than they are in men. But the signs in women are the same, although they're more subtle, as they are in men. Let's talk about them. Testosterone in both men and women is the principal hormone of sexual desire. What creates sexual thoughts, fantasies, desire for sex in both men and women. And so women, like men who have low testosterone, have an absence or a reduction in their desire for sex. Mm-hmm. The other sexual functions, like arousal and orgasm, follow the low desire and are also reduced or take longer or never come, pun intended, because they take a long time or require really significant stimulation in the absence of proper hormones, both estrogen and testosterone. Mm-hmm. The other symptom that's very well known and documented in men that I think is quite important for your female audience is a reduction in lean muscle mass strength, and recovery from exercise. So a typical woman or man who used to be very fit and thin and well muscled
Mhm.
complains about working out, but they can't get rid of the fat, they can't build the muscle, or they have a workout and they're wiped out for the rest of the day after their workout, as opposed to recovering from their exercise the way they used to or the way we traditionally would expect.
If I can follow up here on a couple of things that I think are so important for our viewers to understand, that one, you're just, again, testosterone is the main ingredient, if you will, for sexual drive and sexual desire for women, not just for men. But most women don't know that. Most women don't know they have testosterone. And testosterone is in a way a wonder drug, not a drug, I guess, a wonder hormone, a forgotten hormone to help with this. And the reason I say that so enthusiastically is because I'm one of the very few women that has been on testosterone therapy for 15 years. I do the pellet, bioidentical pellets, and we won't get into a discussion on bioidentical and all that stuff. But that's the only way that I know to get it here, because at your regular gynecologist, there's no protocol for testosterone. You're never going to get it.
That's not entirely true. So,
Okay.
um, Dr. Sharon Parrish, who's an internist from New York, and I, seizing on your comment that we need an instruction book or an instruction manual for doctors and nurse practitioners and physicians' assistants, we put together a paper which we colloquially call the how-to of testosterone, and it's all published. So it tells doctors and other practitioners how to give testosterone in appropriate doses, and whether that's using a compounded therapy or using a man's product but at a woman's dose. All of that is in this paper, and I'm happy to give you the reference to the paper for your viewers. But the answer is it's
Absolutely.
there. It's there.
Yeah. Absolutely. And you and I have not had this discussion, because one of my questions to you was, how do we, how do you educate these doctors? Because my doctor, I wanted to do videos with her, and as Lori, let's get we just realize how difficult it is to try to educate anybody else out there. And then I did go to a gynecologist for hormone treatment, and I was laughed at for
Oh,
about
that's
the,
ridiculous.
but maybe not, ha ha ha, but yeah, it's like, no, it was just, no, we don't give testosterone. Where do you get that idea? And that's why I always enjoy speaking with you so much, because you have been on the forefront of women's sexual health research and treatment, and every segment you've given us information that is incredibly valuable.
It's coming out of the shadows a little to some degree because of people like you and social media bringing it up and bringing it to the forefront. We, in the education of other doctors and other practitioners, are trying to educate them, and we're doing so little by little. I have a very large course on hormone therapy that's going to be this month for practitioners, not for patients, called Experts Teach Menopause. And so, if any of your audience are other doctors, they can log on, or they may be able to come to Washington and
Mhm.
be part of the live audience. But we're working on it, and it's slowly getting better. But,
Mhm.
it's baby steps.
Yeah.
There are 50,000 gynecologists that need to be taught, a couple 100,000 primary care doctors that need to
Mhm.
be taught. It takes a while.
And in the meantime, people our age, we're not going to get any of the benefit. Well, I do, but there's a lot of quality of life that is passing us by not having this information. Not to mention just the health benefits beyond the bedroom. Osteoporosis. Well, let me ask you. It's amazing.
One of the many effects beyond just sexual desire of testosterone is an increase in lean muscle, the strength of the muscle, and along with that, the strength of the bone, recognizing that older women and older men actually lose bone, have fractures of their spine and of their hip, so-called osteoporosis. And much of that can be prevented with proper hormone therapy, both estrogen and testosterone. Testosterone, particularly in men, but has an additive effect on the bone to estrogen in women. It's not all that different, men and women. It's more a question of the amounts of these hormones, not whether we have them or we don't.
Well, and that goes to, yeah, the dosing and again, education and teaching. And that's I know that's a huge challenge. In terms of treatment options, people are listening now goes, well, my God, I want to, I want to try this. Where do I get it? What do I do? What can they do?
So, a couple of things. First, they need to find a practitioner who's comfortable with hormones generally. A gynecologist, that could be an endocrinologist, that could be a primary care doctor. It depends on their doctor's education and interest in the subject. It's not so difficult that a practitioner who wants to become educated and knowledgeable can't do it. It's just not that complicated. But because there's been an absence of focus and training on the subject, their doctor needs to be knowledgeable and have taken their own initiative to become facile in the use of these hormones. First thing, if they understand menopause and menopausal hormones, then chances are they will have some interest and maybe some basic knowledge on the use of testosterone in postmenopausal women. If they don't, they can read this how-to paper that I've told you about and that you'll post a link to.
Yes.
And it's just not that difficult. We in the International Society for the Study of Women's Sexual Health have focused on two primary ways for women to safely and effectively get testosterone. The first is a use of a hormone product FDA approved for men, but one that's easily adapted to lower doses for women, remembering that women have about 1/10 to 1/12 the testosterone that men do. And so that is a gel of testosterone that comes in resealable tubes, because otherwise you're going to waste a lot of that man's product. I'll show you. So this is a testosterone gel product. It's generic, just says testosterone gel on it. And it comes in a box with a bunch of little tubes. Each of these tubes is a 1-day dose for a man. An entire tube for 1 day for a man. Now, a woman would use 6 drops out of this tube and reseal it, and she would have used about 1/10 the dose that her male partner or a man would use. And so one tube should last about 10 or 12 days. And that's easy, makes it much less expensive, and it's widely available. We chose this as an option for for women, because it was available in one form or another almost the entire world.
Now, when you start that, you just keep doing it,
You
or
keep doing it,
Mhm.
but whoever's prescribed it should want to measure your blood
Okay.
to see if you're getting enough or too much. We
Mhm.
don't want a woman to get too much
Mhm.
because she'll get hairy
Mhm.
and lose some
Mhm.
hair. Not a good look on a woman.
Mhm.
And at the same time, there are many women who need more than 6 drops. And
Mhm.
so we can do that from blood work and adjust accordingly for that individual.
Obviously, it has to be prescribed, as you said.
Yes, it's a controlled substance.
So, as we come to a close here, Dr. Simon, what is the takeaway when it comes to women's sexual health and how that affects both men and women when it comes to testosterone?
So, testosterone is the hormone of desire in both men and women. We all have testosterone for our entire lives, but it wanes in both men and women as we age.
Mhm.
While it's not a fountain of youth hormone, it does help to maintain sexual drive. And if a woman or a man wants to remain as youthful, strong, and sexual as possible, they may need it. They just need a practitioner that knows how to do it.
Well, we're going to do our best to keep getting that word out because it is difficult to find. And now we're getting it from the horse's mouth, so to speak. Dr. Simon, I so appreciate your time. So do our viewers. If there anything else you want to add before we close off?
If you don't find a practitioner who knows about it or feels comfortable about it, I suggest you look on the listservs for either the Menopause Society or the International Society for the Study of Women's Sexual Health. Both of them have find a practitioner links where you put in your zip code or your address, and they will help you find certified and interested practitioners near you. And they can either help you or help your practitioner do a better job on their care of you.
Well, and of course, we're going to link to IntimMedicine Specialists because if you wish, you can do a telecall with Dr. Simon directly as well. I know you're super busy, but I'm sure there's viewers that would like to get that done as well.
I'm happy to link with them. And I do have licenses in about 7 or 8 states, so I can prescribe for them. If they're in a different state where I don't have a license, we can clearly do a educational visit online, and I can give them some suggestions for their own practitioner as to how to help them.
Again, Dr. Simon, thank you. Make sure you check all the links below. This can change your life. And I attest to that. I know how it was for me. So thank you for watching, and I look forward to another conversation soon on Second Act TV.